So we're going to share one more kind of, I guess, key program that we've been involved in over the last 2 years. And thinking about ethics of care, thinking about changing the pace of research. This has been a long-standing piece of work over the last 2 years. I'm going to invite our co-priority survey working group members up to the stage. If I have Louise McQuaid, Remi Martin, Shannon Boston, Rachel Erskine, Ceilidh and Munoz, myself, and Haiyin Zhu as well. Ceilidh, do you mind? We're a little bit dearth of chairs, so Remi and Ceilidh, do you mind bringing your chair with you? And Haiyin as well, that was amazing. Okay. I feel like I'm peeping behind this bit, but the most important thing is you can see everyone else, so that's grand. So just to set a little bit of context, and then I'll ask everyone to introduce themselves. The co-priority survey. Now, when we first started working with the network, it felt really important that we were asking communities in rural and island Scotland what they thought was a priority and how they want to be engaged in research and what their experiences were. And we recognized that even with the projects that we had funded, for example, they were a biased sample, as it were. And so we were really keen to think about how we would do a co-priority survey to ask communities wider who haven't been involved with this work, and obviously thinking about the process of how we did that, not just the survey itself, but how we engage with different people with different lived experiences. And so we set up a working group who will introduce themselves shortly. We have been facilitating this as Community Knowledge Matters, and with the support from University of Highlands and Islands, and now the National Centre, and a real focus, as we'll talk about, around how we think about accessibility, doing things a little bit differently as well. So I'm going to ask everyone to introduce themselves. We have, on the top of the slides, Lauren as well, who maybe is in the room as well. And we're not going to invite up, but Lauren, are you around just to give a wave to acknowledge how much work? Oh, no, okay, I take that back. Lauren was here, she has a sneak preview, but she has put so much work into this, so just to really acknowledge that. So, would you like to introduce yourselves?
Hello, I'm Louise, and I'm from Stronsey, which is one of the North Isles in Orkney. When I first joined this, I joined independently as a community researcher, but now I've had various roles since then, but now a senior development worker for the Young Islanders Network, which is a programme delivered by Youth Scotland, working with all young people across all of Scotland's islands.
Hiya, I'm Haiyin. I'm a computer science master student from St. Andrews University. So from this summer, I started to working with the working group and some community member to do my dissertation project, which is making a website for the survey results. And after the dissertation, I found I really enjoyed it, so I'm continuing doing some work to expand our platform and hope can keep this cooperation for a longer time.
Thanks, Haiyin.
Hi, I'm Remi. I wear many hats, but today I'm coming in the capacity of a CAMHA, which is African, Caribbean, Asian and Mixed Heritage Association. We're based in Inverness, kind of, but try to kind of cover the whole of the Highlands. And yeah, it's a voluntary role. This is not my paid role, but yeah, I suppose my contribution has been about kind of looking from a nuanced perspective for this research.
Hi everyone, I'm Ceilidh and Munoz. When I joined the group, I was a Professor of Rural Health at UHI, and I'm now the Head of Programme for Research and Evaluation within the National Centre for Remote and Rural Health and Care, which is part of NHS Education for Scotland.
Thanks, Sarah.
I'm Shannon, and I'm from Shetland. I work at Open, and I run the peer research programme, and we do youth-led peer research. And I joined the group to, I suppose, give that community research perspective.
Hi everyone, I'm Rachel Erskine. When I started this work with the Community Knowledge Matters, I was living in the Western Isles, where I was working as a practice nurse in quite remote general practices, but also I was working with UHI as a lecturer too. And so I've had several job moves and actually moved to the mainland as well. So I now work with Sarah Ann in the Centre for Remote and Rural Health and Care, which is part of NHS Education for Scotland.
Thanks so much, Rachel. Keep hold of it, and then we can we'll keep going with the room. In fact, well, because we're going to go to Sarah Ann, what was the intended outcomes from your perspective?
Thanks, Louise. Yeah, I think the slide really summarises what we hoped we would achieve, and which I think we've gone on to achieve through the work. So, firstly, it was to really understand what matters to folk who are living in remote, rural and island Scotland, particularly in relation to rural mental health and research around that topic. And we really hope to feed into the network itself and the direction it's taking, and ground that really in what people were saying to us matter to them. We also had an eye on trying to help inform wider policy, and a lot of that was around trying to facilitate access to the community-led evidence that the survey would generate. And support further learning, I guess, for other folk and other communities within Scotland by allowing some open access and easy dissemination, so that people can access our findings and our data.
Thanks very much, Sarah Ann. Very briefly, in terms of the timeline of this work, and I know, Rachel, you were reflecting when you saw this on a slide, it was quite, kind of, I don't know, surprising maybe. But this work started in November 2023, so really at the beginning of our funding for Community Knowledge Matters. It was a really key priority to help set the priorities of what the network was going to do. And we knew that we needed a working group, so we had an open call, and through that selected a kind of a wide range of people, an incredible range of people. And we started thinking about the beginnings of those aims, what that would mean in practice, and then putting it through the university ethics process, which I know Sarah Ann will talk a wee bit more about, because we did manage to augment that a little bit to allow the working group to take much more of a lead on that. We managed to launch the survey last year around the time of the gathering, because we weren't busy enough. And this was we opened for a couple of months over the summer, which I think makes the great response even more remarkable, because summer months in rural and island Scotland are usually very busy. And then we started the analysis in October last year. And so it's been a year of analysis with the working group, working question by question. And we finished the analysis in June, and this is when we had the opportunity to start working with Haiyin and Lydia as well, so two placement students, master's students, at St Andrews. And this was happenstance that this happened, but one of the commitments, as Sarah Ann said, was about sharing the data back. And so we had the opportunity, just through a New Scots project we were involved in, to meet the supervisor who offered this opportunity to think about a data visualizer. And that's what we're going to be sharing a little bit later today as well. And so we're launching that today, and you'll have access to the data visualizer in the next couple of weeks to months. What were the questions?
Thanks, Louise. So I think really important to say that we developed all the questions together as a group. It was a really worthwhile process, but it was quite a lengthy process that we went through too. These are the 8 thematic areas that we decided on within the questionnaire itself, and then under each of these areas we had the individual questions that participants completed. So it was really important to us, I think, not to only get people's experience and opinions around rural mental health, but around the whole ecosystem of research associated with rural mental health and wellbeing, and help us, I guess, when we were developing the questions, to think about, what makes it easy or hard for people to take part in this type of research, and what might their priorities be for what comes next. So, we worked together to develop the question set under these main thematic areas.
Thanks, Sarah Ann. And there's a lot about the process, and we've in fact written a book chapter that was just submitted about the process, but we wanted to give a flavour from the working group of what was important to them about the priorities. And so maybe as you have the mic to begin with, Sarah Ann, you can start, and then we can pass around.
yeah, adapting the ethics process. Right, sorry, gosh. Yeah, so I guess when obviously we wanted to ensure that our practice was ethically sound, that was really important to us. At the time you heard that Rachel and I were with the University of Highlands and Islands, so we liaised with the university there. We managed to kind of modify the process a little bit, I think, because normally we would be looking for, or an ethics committee would be looking for the questionnaire to be completed before we submit the ethics application. And we managed to change that so that the co-priority work itself, the development of the survey itself, gained ethical approval first, and then we were then able to work confidently through that process and submit the actual questionnaire itself at a later date. So that gave us a bit more flexibility in terms of timing as well. So.
Thanks, Erin. Do you want to pass to Rachel?
Yeah, I think one of the really big priorities for the survey when we kind of first met, because we did this all online, which, as everyone now knows, is very different from meeting face to face. We really discussed about working, obviously collaboratively, but in a safe way. So it was almost like getting to know each other first and having conversations about who we were, why we were doing this, what our experiences were, but just generating that safety, that psychological safety going forward, but also taking the time to do that, because you can't rush. And as you can see from the timeline slide, this has taken us 2 years to do. So I don't know if we expected it would take 2 years, but I think everyone would agree that it's definitely been at the right pace to do this. And we still want to continue working together afterwards, which I think is a sign of success.
So when I first came into this, it was off the back of one of the Ideas Fund projects that Louise was chatting about, and it was 18 months, and I think at the end of 18 months I was only just starting to understand what it was all about. So that maybe that kind of adds to the timeline. But in terms of navigating the uncertainty, I think probably for at least the first year of this, I came with, I've got more questions than answers. Am I doing this right? Actually, just tell me what you want me to do sometimes, because I'm so confused. So there was a lot of that, and that kind of safe space really helped with that, I think not just me, but I was very, very openly as a independent community researcher able to say, do you know what, I'm not entirely sure what I'm supposed to be doing right now, or if this is the right way. But from that, I think even this morning I just had that reflection when we had the first gathering. I was here with my notes and I kind of rehearsed it, and I'm like, right, this is what I'm going to say and this is what I'm going to do. Whereas this time I've just turned up and I'm like, I can talk it. And I think I've just embraced that fluidity of the process. But the time has definitely, it did take the 2 years to get to that point, and now I'm like, I've got this. I still have more questions than answers, but that was part of the process.
It was really important to us when we were putting the survey together to distribute, to make sure that it was understandable to others and there was different ways that people could access it. So because of that, we made sure that there was an easy read version. We all know when we're starting surveys, there's a whole load of bumps to read through first. We just wanted to get the main bullet points and make sure that people were consenting with informed information. We also got in touch with, before I move ahead to that, we also had easy reads and Gaelic. We also explored some other languages but settled with just English and Gaelic. We also did a voiceover of an animation for anyone that wasn't able to read that easy read, so we're really trying to hit all the boxes of you can take part, you can be involved. And for promoting it, we did some various different things, but a lot of us, or some of us up here, went and spoke on radio stations across the Highlands and Islands to promote the survey. And that was the hopes that we'd catch all the quote-unquote, maybe younger generations via the internet and other sort of means, but by using the radio, we'd also cast the net out to maybe the older generations too, so we'd really put a lot of thought into how we were going to share this.
Thanks, Shannon. And then Remi?
I think it's fair to say that mental health the topic is still quite taboo, and we were very conscious of that, and so therefore we spent a long time really thinking about what language we're going to use, how we're going to frame it, and also clarifying the terminology, because people have different understandings. They have different. It has a different weight to different people. It has a different meaning, and so we were really clear about trying to explain that in the best way possible, so that people know what they were getting involved in, and kind of having that term used throughout the survey and what that meant. I've been involved in quite a few research projects, and language has been a barrier before, and it really does impact whether people feel judged, people feel kind of unsafe to be part of the research. So it really was important that we try and get it right as much as possible. Of course, we're not going to be right for some people, and that's okay. But I think another part of the language is also giving value to the people. So kind of making sure that they knew that we valued their voice, we valued them being part of it, but also they can choose to withdraw their consent at any time. This is, trying in the best way that we can to kind of explain that they have power in this, and where this is, we are hoping their information will be used, and it's not extractive. This is a collaboration, and we want this to, go forward and for the benefit of themselves.
Thanks, Remi. So just to very briefly talk about the opportunity that we had. So we were very clear that the data was going to be shared back to communities. We weren't 100% sure how we were going to do this. It could have just been, a PowerPoint, Excel sheet, obviously anonymized. But we did have the opportunity then to work with St Andrews master students, and Haiyin's obviously on the panel with us today to give, and the kind of brief, I won't talk through all the details of the brief, but really think about how we can keep the ethos of what we wanted to do similar. That co-production, going back to the wider network as best as we could, and obviously working very closely with the co-priority survey as well to develop a platform which shared the data back, but also centered the lived experience, the reflection, the process as much as possible. And so just to give a feel of what that looked like, it was really over the summer, which had its challenges, I think, in terms of, but at the same time, really keeping as best we could with the capacity that we had, as open as possible to get that feedback. Haiyin did a lot of iteration and development of the platform, and obviously we were really excited to share you a sneak preview, and then we're going to be able to send the link afterwards for people to see. So this is where I'm going to transition into the reveal. Little drums. So this is our platform. I'm going to come in close a little bit just to show you a little bit. It's an interactive platform. To begin with, there is some kind of navigation principles over here, just to kind of show people where, all the different parts of it. We've got a bit of the background of the survey that you can interact with. And then we've got the different themes, the different questions that people can click onto. And then the key information about what we have learnt. There are quotes. There's opportunity to ask if people are surprised by the data, to get a little bit of a sense of interactivity and see if this resounds with people or not. If the people have more to say, they can go all the way and share the feedback with us as well. And so you can get a little bit of a sense of the different parts of the resource. We have the priorities themselves. The priorities are over here. And so again, if you click on top of them, you've got the specific quotes. You can understand a bit more about the patterns as well. And so it's not just about presenting the data in a digital way. It's really about trying to put that process in the very center of it. And there's even little bits that we've been doing over the last couple of weeks to really make it a bit more accessible. But hopefully, it gives you a little bit of a flavor. And obviously, the best case scenario is we're going to send you this to play around with down the line as well. So I'm going to transition this over. And I really, at this point, welcome, ta-da! Haiyin, what's been a reflection from your experience of this process?
Hiya. Thank you. First, I want to say it's really my privilege to work on this project. I feel really fulfilled about it. So it's quite a different experience, because when I was learning my computer science degree, we were always told it's about data, about this programming structure. We try to show the lectures, we know this most complex technology and do 200 tests about it. But when I joined this project, I find like this, we're going through 4 different workshops and kind of made the decision slowly, but really thoughtfully. That's a very new experience to me. I think Sophie earlier mentioned that the community research is different from the traditional academic research. That's a very different journey for me. And I end out, like, I find when I complete the website in summer, it was a simpler version of it. I received so much appreciation than I expected. I'm like, this is a simple page application. Yeah, so I think I can see, so there are voices underrepresented, and if we can try to use technology to make people from different perspectives to understand it better and see it better and care about it, I think that's really making an impact in the real world, which is it's better than just master technology. So yeah, it feels really good, and thank you for letting me be part of it.
Thank you, Haiyin. I think, yeah, there's the different expertise in the hats, and it's a simple, I don't know if I could do this, so we were very appreciative. So, we're going to flip into talk about the key findings. Obviously, we want you to explore the data. It will be yours to be able to explore and understand, but we wanted to give it a feel of like the analysis, perhaps, and share some of the kind of top headlines and reflections from the group as well. I think first off, apologize, this is a bit of a small slide, but who responded, Saran?
Yeah, we were really pleased with the level of engagement that we had with the survey. So we had 151 folk respond. And yeah, I think that's a really good number for remote, rural and island work as well. So very pleased. I think one of the things that was really encouraging is that we probably got some new voices within the data as well. 57% of folks said they hadn't taken part in rural mental health research before. We also, the biggest chunk of the pie is Highland, but we do have representation across quite a lot of the boards, NHS boards, and I think the kind of next biggest ones were Western Isles, Orkney and Shetland as well. So yeah, I think in terms of age group, most folk were between kind of 40 and 65, which can also be a bit of an underrepresented group as well. The kind of working age population. 3/4 identified as female, which is quite typical within research. But I think overall we probably have extended reach and inclusivity through what we've done.
Thanks, Sarah. I know there was a similar consultation happening with the Scottish Government, and it didn't receive quite as many results. So I think it was a very long survey, we should say that. You saw the amount of questions, and so to get that level and the depth of those responses, I think we were really, really chuffed with, especially over the summer. So we're going to flip over to Rachel.
Yeah, I hope I'm not going to bore you with graphs. We've been very choosy about the ones we present today. So one of the questions we had was just really trying to ascertain the level of importance that people felt about factors to maintain good mental health and well-being. So we're just going to focus on what people said were absolutely essential and very important. So the winner kind of thing really was social support at 60%. You can see that orange bar. Then it was followed by infrastructure. So we meant things like education and health service. And then housing, which covered also that availability and the quality of housing. And then followed by things like food security, transport, employment, income, and the weather. Because if you live in Scotland, you need to be aware of the weather. Okay? Can the next slide as well, please? And then if you just combined the sort of those absolutely essential and very important levels, you could get a real sense that social support really came out on top in terms of maintaining good mental health. And again, that infrastructure and housing side of things. I think there were some surprises in there. just a couple of things for me about the sort of income employment side of things. But I shall hand over to Shannon for some more responses.
To save me waffling and for the purpose of time, I'm going to read. But yeah, we had, Rachel's told you. So the two things I thought I'd tell you about that we found from these bits of the findings was about infrastructure and impact and combating isolation and stigma. So infrastructure and access impact, things like failing infrastructure and poor access, for example, limited transport, housing and connectivity make rural life challenging, especially when barriers don't seem to be addressed. The current stress felt by individuals and strain of service providers can lead to a perception of a lack of trust in these structures, long waiting lists, services being swamped or no longer continuing to exist leads to disconnection and a sense of hopelessness within communities. There is a delicate balance in maintaining and nurturing existing infrastructure, leading to rural communities feeling as though they're on a knife's edge with no real fix in sight. A quote that we were told that I quite liked was, anonymity is often impossible in remote communities. Access to food banks can be problematic due to rural transport limitations. I thought that told us so much within that one quote. And moving on to combating isolation and stigma. Feeling part of a community is especially important because rural living can lead to real feelings of loneliness, which can have negative effects and have a serious mental health risk. Stigma towards mental health also needs to be addressed within rural communities. Isolation is a real and serious mental health risk, as I've just said. Rural living can be beautiful, but it can also be deeply lonely, with a higher likelihood of feeling excluded or cut off. I've got two quotes for this one. Non-discriminatory community, which is properly educated about difference. And then stigma seeking support, such as stigma around seeking support, such as counselling. Thank you very much.
Thanks, Shannon. Who benefits from mental health research, Saran?
Yeah, this was also a question, obviously, that we asked people to what extent they agreed that different types of organisation benefit from rural mental health research. And I think this helped us understand some of the perceptions of impact and where the impact of research is seen to lie. So the largest category there was about 3/4 of folk felt that charities were beneficiaries of this type of research. I think some of the qualitative stuff was around that, they work closely with folk on a local level and perhaps are one of the organisational types that do put things into practice from research. The public sector came out really strongly there as well. And the third category was those with lived experience. So about 2/3 thought those with lived experience benefit to some extent. But one of the things we noted was that 1 in 5 felt people with lived experience did not benefit at all. So it was quite mixed there as well. So I think we got.
Thank you. Yep. Louise.
So just a reflection on that was seeing that kind of the importance of this community-driven outputs and having the third sector and charity reflecting the direct involvement that those organisations have in service delivery. I guess that comes back to, if anyone is third sector, that they get things done, which is great to see that that's the feedback from the respondents that they see in that from third sectors, that they can use the research and get things done, perhaps from the autonomous decision making that they have. However, it did kind of reflect those potential gaps between the research output and the real world application, especially for those individuals affected and how we overcome that. I've just got a quote there. I think the quote is actually for the next graph. Let me have a look. Yes, it is. I'll come back to that.
Sure, yeah. So this one was about, the barriers to being involved. So we asked folk what might, stand in the way of taking part in rural mental health research. And I think, quite practical barriers came out there. For example, the lack of awareness of opportunities. So just not knowing how to be able to get involved was the top category. But as we're seeing, there's this recurrent theme around concerns about a lack of influence of research. So I think throughout the questions and some of the qualitative answers as well, we saw like a real desire for folk to be contributing to something that's meaningful and makes a difference kind of within their lives and communities. And you've got some other kind of real practical things that I'm sure kind of echo with all of us about being too busy for etc., not being able to find the kind of time to take part. But as you see, even though as we move down the categories there, it still comes out in different ways around that notion of things being worthwhile. For example, difficult to find the results of research. So people really want to know what the results are, and if they feel they won't have access to that, it kind of puts them off taking part from the very beginning. So pass back to Louise, thanks.
So one of the quotes from the respondents was that I understand the words but can't understand what you're asking of me. And I guess initially that maybe comes back to language, but we spent such a long time, as we kind of chatted about, looking at the language and was it accessible, but actually perhaps it is much more of an understanding of what co-produced research is, and is that in itself a barrier? And that kind of comes back to those assumptions within system structures about what you think research is, or how it's used by organisations, and breaking down those barriers that we still very much had a framework, we still had aims, but getting people on board, trusting the process, the fluidity, and letting the process guide the direction rather than squeezing that into rigid parameters. And as I started this, that kind of navigating the way through that for me, being part of this process, I absolutely get where that quote's coming from, because I probably could have said the same at the beginning, like, what do you want from me? What am I supposed to be doing? But that just really highlighted, as a barrier, which I think we're overcoming. Like, everyone in this room is here, so we're clearly overcoming it. But that was kind of that, not so much a language, but a barrier of, it's just different. It's different to what the systems that perhaps people have been used to, and breaking down that barrier and making it not unusual.
Thanks, Louise. And maybe one more tidbit, and I'm going to be a bit interactive. I appreciate this is a very interactive thing usually, and you'll see, but one of the questions, language was really important, and so we and ahed, and I think we even wrote about how it wasn't always that we agreed, but we tried to find a consensus. But I'd just like to get the room's opinion on certain words, let's say. So, I'm going to say words, and I want you to give me a thumbs up if it would make you likely or happy to do the research, if you relate to it. Neutral, or if you just don't want to answer, you don't have to answer. Or if it makes you feel more unlikely to do the research. Okay? Remote. Okay. Kind of, it's split. It's definitely split. Some neutral, some definite no's, some definite yeses. Okay. Rural. Oh, some definite yeses, some definite no's, and some definite maybes. Okay. Island. Big yes from Bobby there. Of course. And some no's. Okay. Neutrals. Mental health. Thumbs up, some neutrals. Mental well-being. Okay. Even higher. Okay, even more positive. Mental ill health. Neutral to negative. Okay. I mean, interesting. So, what did the survey find? So, I'm not going to talk about the detail, but I think a little bit like what we've just done then, it was relatively split in many of the things, perhaps besides, mental ill health is not there for some reason, but mental ill health was definitely the most, I've got the stats here. Generally speaking, it was the most neutral or negative in terms of the reactions. But in terms of everything else, now remote, of course, is one that is very contested, let's say. I think even within the group, there's, remote to some really relies on like a very urban-centric kind of remote to who, to the center. But I think there's also definitely, both within the working group, but also even in the responses, the reality of living remotely felt like it didn't want to, so for some people it's important that was acknowledged and not erased, and that felt different perhaps from other things. So there's no answer here, but I think that hopefully sets some interesting nuance and context to these types of discussions, and I think asking these questions with participants in mind is a really important thing that we should be doing. Remi, would you like to offer a reflection on the language element in particular?
Yeah, I think, again, it's just, it can determine whether people feel like they will want to contribute or not. And I think as well, just, as I said before, just about being clear about what it is that you mean when you're using those terms. It actually just made me think about a time where we were having a discussion amongst the group, and we were talking about the word rural, and we were kind of saying, like, trying to think of, well, what does actual rural mean? And I think, Rachel, you had kind of gone back to, maybe it was a research paper that you looked at, and you were kind of sharing, well, actually, in this context, it means under 10,000 people or something like that. Don't quote me on it. Thanks, Rachel. But yeah, it can really either ostracize people and make people feel like, nah, not me. I'm not that. You can't label me as that, or you shouldn't label me as that, or I'm not part of that. Or it can make people do the opposite and like, yeah, that's a bit of me. That's what I feel connected to. And so I think in the biggest sense as well, I'm also reflecting on the fact that we've used like qualitative questions and quantitative questions. So it gives people an opportunity to really explain, because whilst we've framed the questions, we've got to give people an opportunity to kind of give their own voice and opinion on what it is that we've kind of asked and their responses to that. So I think it's been such a great way to be able to, obviously, yes, we've reframed the questions, but they've had the opportunity to use their own language. Of course, we haven't asked as a follow-up to say, you know, what do you mean when you say that? But we've tried our best to really analyse and trying to hone in, like, what is it you're trying to communicate to us using the language that they can. So, yeah.
Thanks, Remi. Now, for time, we're going to start closing up. I think we might leave this as a little taster for you to explore yourself. What were the priorities that communities wanted to explore in mental health research? But I'm going to bring us maybe just to a final reflection from the whole group, if they would like, what we've learned from the process, and what, I guess, next as we draw to a close, and we'd welcome reflections as well. Who's got the mic? Because that will probably just... Remi, you can start us.
I'm so grateful to be part of this process, especially because we are all from different kind of backgrounds and disciplines, and I think that has just been so enriching for this process. And I think more research should be about a collaborative process between different people, different partners, different people have different disciplines and kind of different contexts. It's just been so amazing, fascinating, and we all get to share perspectives, and of course with the community knowledge matters like ethos of respecting people's different perspectives, and that's okay. It can all exist at the same time. It's just about how to frame that, how it looks like, how to picture that in order to, for whatever outcome. And for us, obviously, it was creating the survey and the research. So yeah, collaboration. Shall I go?
Thanks. Completely agree. I think one of the things that's been really lovely within the group is that we felt safe to challenge each other in a really positive way and you know, challenge each other's ideas and share our lived experience, and I think be really honest about things when we've been discussing the data, which I think has been absolutely fantastic. And it's meant that the research findings, I think, in our research interpretation are much richer for having that discussion. And more meaningful. So, as we've said, I think a few times, it has taken time, and it's taken time to build that trust, but time really well spent, I would say. And, you know, people do talk about the length, and maybe this is slow research, but I think it's really deep research. We're actually, it's much more intellectually meaningful and rich because of the process that we've gone through.
Just echoing what everyone else has said here, it's been a journey, it's been a while. I think it's been nice to back up all the different things that I'm learning on my own research journey about things do take time. You need to find the right questions, and we quite like to say open that there's no stupid questions, but there's definitely not been that in the group. We've been able to ask anything and learn from each other. It's just been a really nice to get to know everyone, and yeah, thanks.
Yeah, again, I'm going to just echo some of the comments that have been made too, but I think the time perspective for me has been absolutely fascinating. I think I've been so used to, in an academic world, having deadlines, trying to get students through their dissertations, funding deadlines, and it echoes a lot what Sophie said actually earlier on about the power dynamics in a group too, that you can't eliminate power completely, but I think working collaboratively has been done so well with this group. I think there could have been a sense that because Sarah Ann and I came from a university background to start with, that we would perhaps drive it, but it's certainly, and I hope everyone else has felt that it's been very much the other way around, that we've learned so much from the communities and the community members, more than probably I've learned from a lot of academic stuff over the years too.
I just wanted to share a personal reflection from this process. So throughout all of this, obviously we've said it was a long process, and in between working full time and all the other roles that I have, I was studying for my master's degree part-time, and 2.5 years into it, I quit it. I'm not going to say entirely because of this, but it was definitely a contributing factor, and not in a negative way. I just felt so bound by having to follow a process and even analysing research, which was one, out of date, and stuff that I was working day in, day out, and knew I was challenging it. That maverick approach didn't go down well with my lecturers, and I just quit it because I couldn't do it, and it was really infuriating. I became really disillusioned. So it was in education, childhood and youth work, but I became really disillusioned by that process and that framework when what we were doing in reality was so different and had so much more value. So that's my personal reflection. That's what I got from this. I quit my master's degree because I was, fighting against the bureaucracy of it. So, yeah, I ditched it to do something more real.
Maverick, hey. And if they're watching, and maybe just a final reflection for me, and, just acknowledging how much, I think that point Rachel was making about the co-production bit, even recognizing how much we've, this whole presentation, we've discussed who's sharing what. I know that, me and Sarah Ann have been talking a lot, for example, but that was very much with the consent of the group. And I think that really, co-production is not necessarily about everyone doing the same thing. It's about everything. For me, it's around consent, and it's around discussing what people want to contribute to, what people have the capacity for. And one of the reasons why it's been slow research is because it's difficult to get people together for this long amount of time who have lots of different hats. And that was a challenge to keep that momentum, and it required a lot of holding. And again, just to acknowledge how much work Lauren had been doing previously as part of that holding, and I think it's been important to have that, being able to have that flexibility to do it, because it could have easily, broken apart, really, to be honest. So, what next? Just to start finally finishing off, really, we are going to share the data visualizer. We'd really love your perspectives on it. We have co-written, and we've all written parts of a book chapter, which is going to be submitted. It's going to be fed into, we fed into the International Declaration of Ethical Rural Mental Health Research. I'm continuing to be collaborating on that international perspective. So there's other rural, there's Canada, India, other different parts of the world. And we're really, at the moment, really excited about the data visualizer. And obviously, you've already got a glimpse of it. But once you start playing around with it, we're really interested in the idea of how we could develop this into a platform that other communities can also use as a resource to share. And that's something that we're in conversations with, maybe in Murray, but in other places as well. So, to finish, we don't have time for questions, and we are going to finish. But I do want to, I've got a Mentimeter up there. If you'd like to share any reflections or questions, I'd really welcome that. Obviously, most of the group are going to be here for the whole day, so just chat to them. that the Ceilidh, give a dance, ask them questions, and do keep in touch with us. I'm going to quickly flip that because it might not be the right slide. Is it the right slide? We'll find out. Seamless. It should be this one. There you go. But whilst we're transitioning, I'm going to leave this slide up, and I'm going to say what's going to happen next. We are going to have the spotlight very shortly, so you might want to take a bit of a comfort break in between, but we are going to start about 5 minutes past. As I said, please do keep taking breaks as you come along, because I know we've packed a lot in. And there are 2 talks in this room that are going to be live streamed as well. So we have Open, who are going to go straight afterwards, poor Shannon, and we're going to have Murray Wellbeing Hub, and so there'll be half an hour each. And in the other room, we have Space to Be in Lochaber, over here. And we also have Emily, is in the room, Play Streets, Inverness, which is actually doing research on a street which is right next to this space, which I absolutely love the connectivity of. And that will be in this room over here. So you'll transition into these 2 talks. But can we give our co-priority working group a massive round of applause?